Top AI tools every healthcare leader must know. When we talk about artificial intelligence in healthcare, we often think about doctors diagnosing diseases or robots assisting in surgeries. But what many people miss is the critical role AI plays behind the scenes, supporting healthcare leaders in managing operations, improving patient outcomes, reducing costs, and boosting staff performance. As a healthcare leader in 2025, understanding how AI can transform your organization is no longer optional. It's essential. So today, I'm going to walk you through the top AI tools every healthcare leader must know to stay ahead of the curve, optimize operations, and lead smarter. Let's start with something that's truly revolutionizing the clinician experience. Nuanced DAX Copilot. This tool, powered by Microsoft and integrated with the Epic EHR, is a game-changer for automating clinical documentation. DAX listens to the conversation between doctor and patient, then automatically generates a structured clinical note in real time. For healthcare leaders, this means physicians can reduce time spent typing notes after hours, often referred to as pajama time, which directly improves job satisfaction and reduces burnout. Not only does DAX streamline workflows, but it also helps improve documentation accuracy, which in turn supports better patient care and reimbursement outcomes. Next up is iDoc, AI for radiology and imaging workflows. If your organization has a radiology department, iDoc is a name you need to know. This tool uses deep learning to scan radiology images and identify critical findings such as brain hemorrhages, strokes, and pulmonary embolisms, often faster than a human can. What makes iDoc particularly powerful for healthcare leaders is that it doesn't just read scans, it integrates directly into the workflow. It alerts the care team in real time, so they can take immediate action. For executives and clinical directors, this translates to faster diagnoses, reduced length of stay, and better patient outcomes in time-sensitive cases. Next up is Cuventus, real-time hospital operations. Running a hospital is like orchestrating a symphony. Everything needs to be in sync: bed capacity, staffing, surgery schedules, and ER flow. Cuventus is an AI tool designed to optimize hospital operations in real time. It analyzes historical and live data to predict bottlenecks and recommends proactive actions. For example, if it sees a likely spike in ER admissions tomorrow, it may suggest adjusting staffing or accelerating discharges today. Healthcare leaders use Cuventus to manage length of stay, reduce delays in care, and even prevent burnout by smoothing out operational chaos. It's like having a 24/7 command center that never sleeps. The next tool is Buoy Health, an AI-powered patient navigation that is more patient-facing but still important for leadership to consider. Buoy Health is an AI-driven chatbot that helps patients self-assess symptoms and guides them to the most appropriate care option, whether that's a telehealth visit, urgent care, or a specialist. For healthcare leaders focused on consumer experience and access, Buoy helps direct patients to the right level of care, reducing unnecessary ER visits and improving patient satisfaction. It also integrates with scheduling systems, which means it doesn't just tell patients what to do, it actually helps them take the next step. And last but not least is AI, a clinical risk prediction and population health platform that predicts clinical deterioration, hospital readmissions, and other high-risk events across populations. Doesn't just highlight risks, it provides recommendations for interventions. For healthcare executives focused on population health and value-based care, this tool supports smarter care management, improved quality scores, and reduced penalties from avoidable readmissions. It's especially valuable in managing chronic conditions, post-acute care, and social determinants of health, all areas where traditional data alone may fall short. So there you have it, 6 AI tools that are transforming healthcare leadership as we speak. Nuanced DAX for documentation. iDoc for imaging. Cuventus for hospital operations. Buoy for patient navigation. And Juvion for population health. Each of these tools serves a different purpose, but together they reflect a common truth. AI is no longer just a future technology, it's an operational necessity. As a leader, your role is not to become a data scientist, but to understand how these tools work, what problems they solve, and how they align with your organization's goals. The future of healthcare will be led by those who can combine vision with innovation, and AI is at the center of that transformation. If you found this helpful, please hit like, subscribe, and drop a comment below. Which AI tool are you most excited to implement in your organization?